All right. So today is day 5 of our internal medicine primaries West African group discussions, and we are still going into the MCQs that relate to West Africa from the previous exams. So I will start posting questions immediately. This question says podocyte effacement is typically seen in option A, minimal change disease, option B, focal segmental glomerulosclerosis, option C, diabetic nephropathy, option D, membranous nephropathy.
Minimal change disease.
All right. We also have a channel where we can. Please let's not move these things. Let's avoid doing anything that will affect the slides. Dr. Abdullah, you are the one selecting it. Please stop.
Okay, sir.
Yeah. Don't select it, just let it be. Let's attempt the question so that we can move to the next thing. So when you look at minimal change disease on electron microscopy, what you particularly know is Dr. Rukaya. Let the things be. Just let it be. Just let it be where it is. When you move it around, it's affecting the discussion. Don't select it. Just leave it.
So the challenge is that it's not showing very well. That's why we are trying to put it at the center.
Huh?
It's not showing very well. We can, from my hand, I can hardly see the question clearly. So that was the reason why I was
Put your
putting
screen,
it.
put your phone in landscape. Don't move it. Don't move it because you're also moving it for other people. Put your phone in landscape mode. You can put your phone in landscape mode and it to show to now become wide. If you are watching it from portrait, it will be narrow. But if you put it in landscape, it will now become wide, so you will see it very well.
Okay. See the same thing now.
So the correct answer is minimal change disease. So option A. This question we've discussed biotransformation earlier, or still discuss it again. Like we saw a question on it sometime earlier. So what's the main process in phase 1 biotransformation? You have conjugation, hydrolysis, oxidation, sulfation. So when you answer that, we move to the next one. Attempt the question, guys. Let's move now.
Oxidation. Option C.
Oxidation, sir.
A bunch of codes. Okay, hold on. So the question, let's attempt it. I've posted it properly in the chat.
Option C. Oxidation.
Huh?
Option C. Oxidation.
Well, I can't hear you. Either you're using microphone. You can type actually. There's a chat box.
Okay.
Yeah, oxidation. If you know about phase one biotransformation, even um, you know, all these hydrolysis, they're also like phase one. And so when you start talking conjugation, that's phase two.
Phase two.
When you're adding something extra to it, that's phase two. So this question is a biostatistics question. If you're familiar with the syllabus of the exam, you see that um, statistics features in the exam. So on biostatistics, which which of the following uh, indicates true or false, right? Nominal scale, ordinal scale, interval scale. Those are the options there. Somebody has started moving this thing again. You guys are frustrating me. Dr. Oko, why are you moving it? Put your phone in landscape mode. You'll see it properly. You'll see it clearly. When you move it, there are a lot of things that will change. Now we don't know which option that we ticked earlier. Other people will not see it. Okay, so what we're going to do now, we're going to share our screen to everybody because when you see a topic like this that you haven't come across before, you should be able to master it. So apart from just answering this question, we want to know what's the meaning of a nominal scale, what's an ordinal scale, what's an interval scale, right? And everybody will be able to explain all those things. So in biostatistics, scales of measurements are used to describe the level of precision and detail, in a variable. So here's common scales of measurement. Nominal scale, assigns names or categories to a variable without any inherent order or ranking. So it's just nominal means name, like right? Name. So nominal scale just refers to the name, just names, categorizes variables just based on the name. Okay, there's no order, there's no ranking, there's no this is like Burna Boy, Davido, you know. whiskey, there's no ranking, so it's just there's no inherent order, there's no ranking, so it's just the names, right? uh It's used to identify unique characteristics or categories without any numerical value. So eye color, example, eye color can be blue, it can be brown, it can be green. There is no number, there is no ranking, there's nothing, right? So it's just the names of what it is you are describing. So ordinal scale, as the name suggests, ordinal, that means there is an order to it. So nominal scale is based on the name, ordinal scale is based on order. So an ordinal scale is a scale that assigns rankings or orders to a variable, but the distance between each rank is not equal. Okay, it's used to identify the relative position of a variable. So temperature scale can be hot, warm, cool, you know, cold. So it's an order, is identifying an order, right? But you cannot really quantify it in numbers. So the final one is intervals. Okay, the third one is interval scale. An interval scale is a scale that assigns numerical value. So this is one now the one that assigns numerical value to a variable and has equal intervals between each value. So that's equal intervals um, differentiates it. So ordinal just assigns order, but no equal interval between them, right? But interval assigns numerical value, that's numbers, okay, and has equal interval between each value. It allows for calculation of differences and ratios between values. So temperature, you can now measure it in Celsius or Fahrenheit, right? So ratio scale is a scale that assigns numerical values. So ratio also involves numerical value, okay, to a variable and has equal intervals. So numerical values, equal intervals between each value with a true 0 point. It allows for calculations of differences, just like this one. But now there will be fractions between values. In this one, there is no fraction. In intervals, there's no fraction. It's like whole numbers. But in ratios, you can go as far as necessary. So example is weight in kilograms or pounds. Correct answer. What was the question again? So it's actually a nominal scale that will just say whether it's like true or false. There's nothing, there's no description, it's just nominal. It's true or false. So um okay, so yeah, I think it's nominal scale that will just describe this thing as true or false. Okay, because it's just there's no interval, there's no number, there's nothing. It's just a description based on these options. I think it's nominal scale. For those who are just joining us, you're welcome. Please don't move anything on the slide, on the what do you call it? On the screen. Can if you're not seeing anything well, you can put your phone in landscape mode. Okay, just turn your phone don't put it in portrait, put it in landscape. That way you have a broader view on the screen of whatever it is that is visible on the screen. The next question. The next question, okay, is about the GI plexus of nerves. Well, there's a twist to it. We answered the question about GIT earlier, about Meissner's plexus, all the stuff, right? So, but this one has a tiny twist. So, about the GIT, option A, Meissner's plexus is aganglionic, Ulbach plexus is responsible for secretion, Meissner's plexus is ganglionic. Well, let's attempt the question then. I don't know if I've deleted where we solved something like that. Okay, maybe I've deleted it. Okay, so you guys are choosing option C. That they will discuss this thing. We said there are two types of plexuses. There's Meissner's plexus and there's myenteric plexus. So another name, another name for the myenteric plexus is the Albach's plexus. Okay, and it's inside the muscle, and that makes sense that it's more likely to have ganglions. And this one that is inside the muscle is involved in contraction, so it controls contraction and relaxation of smooth muscles. But the one that is submucosal, which is the Meissner's plexus, okay, it's aganglionic and is involved in secretion. So here in the question turns it upside down and says that Meissner's plexus is ganglionic, Meissner's plexus is aganglionic, Albach's plexus is responsible for secretion, which is not true. Albach's plexus, which is also known as the myenteric plexus, is responsible for contraction of the smooth muscles. Okay, so that's something to take note of. These are the basic things about this plexus. One, there's Meissner's plexus, which is the submucosal one, just under the mucosa of the GIT. Okay, and it's involved in secretion, and it makes sense because the glands that produce those hormones and all those stuff, right, are just under the submucosa, right? So you expect the submucosal plexus to be the one in charge and controlling them. Okay, then the Albach's plexus is responsible for secretion. Sorry, it's responsible for contraction because it's also known as the myenteric plexus because it's between the muscles. Myenteric, which means is in the muscles, okay, muscles of the GIT, right? So it's involved in contraction, while Meissner's is involved in secretion. And then something that is close to the mucosa like that, you don't expect it to have ganglions, so it's more likely to be aganglionic than the other one. So this is the correct answer. Okay, next question. There's something called the corneal reflex, and this next question is testing the knowledge of. The correct answer is A. It's testing the knowledge of that. So it says corneal reflex Option A, facial nerve. Option B, trigeminal nerve. Option C, facial and trigeminal nerve. Okay, so for those who are, you know, who are not even sure what the corneal reflex is, come to everybody. So option C is both mediated by the trigeminal nerve and the facial nerve because it has a sensory and a motor aspect. We know that trigeminal nerve is majorly sensory and facial nerve is majorly motor. Okay, so and there was a day that we discussed trigeminal nerve. We said that it has three major branches. Okay, the oculomotor branch, which is the ocular
Ophthalmic.
branch, ophthalmic branch, which is the one that supplies from uh, the lateral epicanthus. Okay, that's the angle of the eyes up that forehead area. Everything there is supplied by that ophthalmic branch. Then the second branch, which is V2, covers the area between that lateral epicanthus down to the angle of the mouth. Okay, so all that area around the cheek and everything there is supplied by the maxillary branch, which is called the V2. Then the final branch is the third one, just below that the angle of the mouth down. Okay, supplied by trigeminal nerve, um, third branch. Okay, which is the mandibular branch. Okay, so it means that trigeminal nerve basically takes all the sensory impulses. The only muscle that it supplies is muscles of mastication, all those masseter and all those kind of muscles. Okay, that's the only muscle that trigeminal nerve supplies. Apart from that, it's sensory. So the corneal reflex means like that's what helps you to blink when like if someone throws a stone or something is happening around your eyes, that blinking that you're having, that's the corneal reflex. That's the blink reflex. So it has both sensory, which is coming from the trigeminal nerve, and motor. Motor is what blinks the eye, okay, and that's coming from the facial nerve. So um, and we know that facial nerve controls the muscles of facial expression, including the orbicularis oculi, which is what contracts when you are trying to blink your eyelid. Orbicularis oculi. So that's why it's option C that is correct. So it's both facial nerve and trigeminal nerve for corneal reflex. If you are just joining us, you are welcome. But please don't move the contents of the slide you are trying to create because I'll still paste it in the group chats. If you are finding it difficult to see it very well, just put your phone in landscape mode. You will see it wider and better. Okay, so I'll go to the next question. Okay, this question discusses X-ray features of X-ray features of hyperinflation. So this is like a core medicine topic. X-ray features of hyperinflation. Option A here says narrow mediastinum. Narrow mediastinum. Please don't move anything, don't touch anything. Narrow mediastinum. Option B, hyperlucent long field. Option C, horizontal ribs. The question itself is not there, but just know that the question is X-ray features of hyperinflation. So these are the options there in the charts.
The only odd option here is option C. Both option A
What?
and option B are correct. I said the only odd option going by the questions is option C. Option A and option B can be the features of hyperinflation in lungs.
Okay. Let's see what others will answer. Then we'll narrow it down. Let's attempt the question now. Sometimes West Africa could just be the odd man out. Maybe if they're supposed to put an except, they may not put an except. Sometimes they do like that. So is there any word like hyperlucent? What's the meaning of hyperlucent?
Hyperlucency is that the
Huh?
bilateral hemisolar tube, it's going to be dark in the air field will with the air field, the lung zones, they are going to the dark.
Are you using an earphone? Your voice is very muffled. It's difficult to hear, to
Okay,
understand.
I said for hyperlucency, the lung zones are going to, the darkness is going to increase darkness
Okay,
for
okay, I understand what you're
hyperlucency.
saying. Yeah, I understand what you're saying. Okay, so that's using X-ray terminology.
Yes, sir.
Okay. Hyperinflation. Well, I'll look for a picture of hyperinflation so that you can appreciate it. Hyperinflated lung. As you can see, well, you just manage this image. So the image of X-ray features of hyperinflation. So after that, we'll come back to, with that image in mind, you can see how white everything is looking, so dark and white. Okay. So dark and white, like the ribs are even like, the long field is so dark. Okay. So that's basically the picture to have in mind when they're talking about hyperinflation. Then the diaphragm is supposed to be flattened, almost flattened, no longer normal the way it's supposed to be. See, this thing is looking like dome shaped. Okay. So hyperlucent lung fields characteristic feature of hyperinflation because of the increased volume of air in the lung fields, right? Um, Narrow mediastinum, also a feature of hyperinflation. The increased volume of air within the lungs can cause the mediastinum to appear narrower due to the shift, okay, of the mediastinal structures. So, like, it will just appear narrow. It's not like it's actually narrow, but like it's as if there's just so much air everywhere. So it will just, because of that dark, that hyperlucency, that dark field, some things will now become as if they are smaller. So the mediastinum will appear smaller. That's the narrow mediastinum. Then horizontal ribs, basically like it flattens out the ribs, stretches them beyond their normal curved angles. So they will now appear almost horizontal, and then flatten the diaphragm as well. So because of the increased volume of air also. So basically all the features there, um, all the features there are actually features of hyperinflation. So probably there may be a third feature that, you know that is probably not there. Do you get? And so maybe in the question they will now change the format and then put an option that's um, another option. So probably I'll add an option D, all of the above. But probably in your exam, they'll probably put another option, maybe that is off or something. So it's the way the person recorded it. All right. So on a normal endocardium, this question has only two options, but you get the idea. On a normal endocardium, what type of cell do you expect to find on a normal endocardium? Option A here, macrophage. Option B, endothelial cells. So probably maybe they'll add lymphocytes, they will add whatever else that they want to add there, platelets, So what's like the normal endocardium? Endocardium is the layer, thin layer that lines the inner surface of the heart. So this is like the mucosa of the heart, the inner mucosa of the heart, the inner walls. So what's that endocardial layer? Is it a macrophage? Is it an endothelium? What is it? Please let's participate in the discussion. It's getting like you guys have to participate and contribute. Of course, it's endothelium now. Like it's the obvious answer there. Endothelium is like the cell that lines blood vessels, and the heart is like the biggest blood vessel. You know, so still that same continuous single layer of endothelium that lines all of them. This is an investigation result that shows a breath abdominal examination shows a breath. So, um, what's the right investigation to do for the patient? If you saw a brew on abdominal examination, what's the right investigation to do for the patient? Option A, CT angiography. Option B, plain X-ray. Option C, renal arteriography. A breath implies that there's a blood vessel obstruction somewhere,
Stenosis. Stenosis.
and it could be from you can pick a brew from the kidneys, you can pick a brew from the liver itself. Okay, so we have a divided house, CT angiography, we have renal arteriography. So what does everybody think? So a CT scan can pick stenosis, aneurysm, atherosclerosis. Uh, so a CT angiography, because it's an angiography, it can pick all these things in the vessels. It's very useful in this situation like this. So where you pick renal arteriography, it's like if they gave you the particular pinpoint and they told you that it's coming from the renal area, then that will probably suit your narrative. You get so. But now you're still on a general note. They didn't tell you where the brew is or something. So city and geography would probably handle it better. Okay. On to the next question. So option A is correct. I'm not going to say anything, but let me see. Let me see those awake. Yeah. This is a unique question.
Once beaten,
Following.
Chief.
Yeah. Yes. Okay, so
No, Chief.
everyone.
I said once beaten, twice shy for the question. The corner reflex.
See, everybody's supposed to get this question. Dr. Hillebo, were you sleeping? Please, someone should explain to her. Just put on your mic and explain so that it's coming from someone else's voice. Maybe
No,
she will
sir,
understand.
sorry, it's a typo. I followed. The trigeminal nerve is for sensory and the facial nerve
They
makes
both
the
control.
eyelids to go.
They both control corneal reflex.
What's the
Sorry.
reason I gave? You said that what happened?
You said the trigeminal nerve is responsible for sensory, so it feeds the
Trigeminal.
sensation. Yes,
Yes, it's responsible. Like it's corneal reflex. So there's two aspects. There's sensory that's going to pick up the impulse that someone wants to throw something or like something wants to happen. You get.
yes,
And
yes.
then there's the motor that will react to it. So it
The
requires two
facial
nerves.
nerve.
So trigeminal for sensory, facial nerve for motor.
Mhm.
All right. Okay, which of the following is not mediated by the dorsal column medial lemniscus pathway? Vibration, fine touch, crude touch, 2-point discrimination. So which one is not mediated by dorsal column medial lemniscus pathway?
True touch.
Okay, type in the. Let me put it here. The question again: which of the following is not mediated by dorsal column medial lemniscus pathway? So let me look for an image. Cross section of the spinal cord. That's what we're looking for now. I know some of you have forgotten these things from anatomy, neuroanatomy, right? But welcome back. You want to do residency, you have to know it. Cross section of anatomy of medial of spinal cord. It's going to show you all those things, ganglions and blah blah blah. So there's a dorsal column. There's a what's the other one? Spinothalamic tract. Okay, so I'm looking for an image that will show those things so that it will get just plain. And like every part of the body now, there's a motor and there's a sensory. Okay. The meaning of that dorsal column means like it's actually, you know, posteriorly placed. And a column runs longitudinally, okay, along the spinal cord. So it's a column. It runs from up to down, okay, and takes sensory impulses from all the parts of the body, right? Taking it back to where the brain, you know, and the cerebellum that is involved in movement and all those things. So hold on, let me look for which one is dorsal column now. Yeah, so let me see. Let me manage this one. I'm sharing a tab that is supposed to give you an idea of what's going on. Um, So in this is a cross section of it, like a transverse section of the spinal cord. So you are looking at the spinal cord now. A part of it is going to be sensory, especially this one at the back. Okay. Then a part of it is going to be motor. And we know that motor brings impulses from the brain to the muscles, right? While sensory takes impulses from the skin and the joints, okay, back to the spinal cord and then to the brain. Okay. So the one at the back, that's why they call it dorsal in your anatomy. Now you know that dorsal, ventral is anterior, dorsal is posterior. So the one at the back is usually sensory. So there are usually two tracts. One is called the dorsal column medial lemniscus, like it's dorsal, like it's at the back, and it's a column and is posterior medial. Okay, so it's called dorsal column medial lemniscus. And then uh, there's another one that is supposed to be somewhere here laterally. It's not in this image. That's called the spinothalamic tract. So spinothalamic tract usually carries impulses for temperature and fine touch. That's light touch. Okay. While the dorsal column medial lemniscus carries more, like much more coerced impulses, like crude touch or pressure, okay, vibration and joint position sense, 2 point discrimination, all those things, okay, are carried by the dorsal column medial lemniscus. And this thing comes into play. What's the name of that syndrome? Where you have a hemitransection of the spinal cord. It comes into play. Is it Brown-Sequard syndrome? Maybe read it up. This thing we are discussing here now comes into play because if you semi-transverse this spinal cord, something is going to be happening here. Anyway, that's a different topic. But that's the main point. Okay, so if you have that at the back of your mind, it gets easier to answer these questions. So let's see. Show the whiteboard. So functions of dorsal column medial lemniscus pathway. Okay. Okay. So the light touch is mediated by the dorsal column. Okay. Then the crude touch is mediated by the spinothalamic tract together with temperature. Okay. So there was a bit of a confusion there. So joint vibration, joint position sense, 2 point discrimination, fine touch, except crude touch. All of them are for dorsal column medial lemniscus pathway. Dr. Sheun, what is on your screen? You can unmute yourself so that we can have a conversation. Like you tell me what's on your screen so that I'll guide
I
you.
can see the participants on my screen presently.
As look through the participants. One of them is whiteboard. Click on that whiteboard. That's the whiteboard.
I'm not seeing any whiteboard on the participant. There's only Air Clinic I can see and the other participants.
Other candidates, are you seeing the whiteboard?
No.
Yes, I can see the whiteboard. Have you tried scrolling up to the top?
Magnus granulomatosis. Okay, see. This one is for some of you that have done PP in O&G departments. You know, as a physician, O&G people will invite you to come and manage hypertension for them. They will invite you to come and co-manage preeclampsia with them. So you ought to be ready. This is a question of a pregnant woman. Uh, question of a pregnant woman with BP of 160 over 100 millimeter of mercury on first antenatal visit at 14 weeks. Then at 24 weeks, I have to break this thing so that to not leave the screen. All right, so a pregnant woman with a BP of 160 over 100 millimeter of mercury on first antenatal visit at 14 weeks. Okay, then at 24 weeks, the BP was 165 over 110, 2 plus of protein. So what's the diagnosis here? Is it that the
That's
patient has
eclampsia.
preeclampsia or the patient has long-standing hypertension with superimposed preeclampsia? Which one?
That's preeclampsia.
Preeclampsia.
Long-standing hypertension is
Now we don't
superimposed.
do O and G PP. What do you think? And what's your reason?
Okay.
What's your
Was
reason
it
Okay.
for
Yeah.
choosing the option?
I will go with long-standing hypertension because for for one to make a diagnosis of preeclampsia, it must be greater than 20 weeks of pregnancy.
Okay,
But this patient already had an elevated BP even at 14 weeks of pregnancy.
okay, okay. That's very good. Yeah. So that's the just that 20 weeks cutoff mark is the main thing. Is the main point about this question. Okay. So maybe they're asking you this question again, they may change the dynamics. Just know that 20 weeks is what if you get a an elevated blood pressure before 20 weeks, it means the woman is already having like
Hypertension.
essential hypertension, before that time. Okay. So, but if you get it after 20 weeks, it means it is hypertension in pregnancy. So there are three different things here, or even four. So if you get it if you get high blood pressure after 20 weeks, it is hypertension in pregnancy. But if you do urinalysis and then you now see protein, okay, significant proteinuria, that tells you that it is what? It's now preeclampsia beyond 20 weeks with increased blood pressure plus protein uh, availability in the urine. That makes it preeclampsia. So protein must be there to make it preeclampsia. And then between preeclampsia and eclampsia is the presence of seizures,
Yes.
okay, or pre-seizures, like when they're already having signs, some other fulminant signs, eye signs, visual disturbances, headaches. uh So that tells you that eclampsia is very near. And to manage these patients, you need to bring down the blood pressure with probably labetalol, IV labetalol, and you need to prevent this preeclampsia from progressing into eclampsia with what? Magnesium
Maxwell.
sulfate. Yeah, so
Maxwell?
magnesium sulfate is your go-to for these patients. Okay, there's a question here. It's asking about H. pylori. It has just two options, probably what the candidate can recall. But that should be enough to give you an idea of what the question wants to test. H. pylori is a gram, mostly in childhood, start mostly in childhood, is a gram positive organism. So which one will you pick? Helicobacter pylori. Is it a gram positive organism?
Gram negative.
It's not a gram positive organism. There are very few gram positive organisms. Like if you know the gram positive organisms, it's very easy to not have to know the gram negative organisms. There are fewer gram positive organisms. Okay, so if you mention staph, you mention strep, you mention bacillus, you mention corynebacteria. I used to have a code, I can't remember.
It's
But
gram
you
negative.
mention what?
Yes, Chief.
You
Listeria.
want the, yeah,
Listeria monocytogenes.
Corynebacteria. That's corynebacteria.
Yeah, Listeria
Listeria,
Listeria
monocytogenes.
yeah,
too.
Listeria monocytogenes. Yeah. Is it BLS or something? I can't remember what I used to remember it in. But like I don't need the code again to remember it, but like just to make it easier. But if you remember staph and strep, okay, you know that you've done a great job for bacteria. Like the way I used to remember it, staph, okay, staphylococcus is like they are both gram positive
Coca.
cocci. Do you get? So the difference is that staphylococcus is in clusters. That's why it's called staph. Okay, it's in clusters. But streptococcus is in like a strep, like a strip. Do you get? So is in a chain. Okay, yeah, that's the word. Is in chains. That's streptococcus. Then staphylococcus is in clusters. Okay, so those are some of the your microbiology. I said is just
Yes,
take
Chief.
staphylococcus is
And
a
also,
gram-positive
Chief.
organism, streptococcus, bacillus, and then corynebacteria,
Yeah,
then
bacilli.
listeria monocytogenes. Then you know that all this what do you call it?
They call some spore forming bacilli, while there's no spore forming bacilli.
Yeah,
For
I
the
don't even want
spores,
to go
yeah,
into each of the each of
okay,
this one. Just a general view. Do you get? Then
view.
like what's this class that has tuberculosis?
Mycobacterium.
Uh-huh. They are weekly gram positive.
Uh,
So they are weekly gram positive. The major test for them
weekly
is
acid fast.
yeah, they
Acid
are weekly
fast.
gram positive. So you can still classify them as gram positive. So all those leprosy and tuberculosis, they are also gram positive, but they are weekly gram positive. But the major way to identify them is through acid fast tests. Okay. It's the acid fast test that really captures them very well. So that's why they call them acid fast bacteria. All right. So our answer here, based on the fact that we know that this is Lili, you get. uh So we'll pick this one,
B.
but we need to research it to understand it better. So let's look at air body. All those intestinal organisms are majorly gram negative. So H. pylori, like we know, it's like the major organism that is, you know, is the major culprit for peptic ulcer disease, right? So it's spiral shaped, gram negative. Okay, it lives in the stomach. It survives in acidic environment. That's why it can survive the ACL, the stomach, and it doesn't die. It's very difficult to treat. Okay, so that's basically it. So they are usually acquired in childhood, and the bacteria can persist in the stomach for many years, leading to chronic infections, into adulthood.